because they smoke, because they pollution, or they eat too much butter or too much junk food. So the arteries become normal, and look at one, two, D is the worst, and the other one is a lateral view. So the chelation go and clean the artery. In the United States, you can take chelation, but the chelation I do is the one doctor ever teach me, and he said, please don't change much, because I spend my life working on this. So we try to don't change too much, because he spent his life working on this. This is one of the very important things about my clinic, and I'm sure about other clinics, is the detoxification, the cleansing of the body. You know, some people say death starts on the colon, and I'm believe in a good way, because when your colon is not working right, you are in troubles. And if I ask you who got colon problems, well, many of us, we got colon problems. How to take care of that? Well, eating well, eating fiber. At these days, people eat too much fat and too less fiber. Need to be the other way. When you do this way, more fiber and less fat, your chances for cancer are less, and to keep healthy are better. When I need to take X-ray, well, I do it. That's a colon enema, a barium enema. So we can see the colon. You can see all twisted, all twisted. And many of us, we got, especially women who are deliver, or Amish people like to have 10, 15 babies. Well, after carry 15 babies here, your colon drop or is in trouble. Then this is a chest X-ray. Well, like I said, I'm a conventional doctor, so I do. Look at what, this is a real picture. I don't take it for any place, just for one patient. That's a plaque comes from the colon. After using the detoxification, this come out. So how is this patient is going to get well if you don't remove that? I took it like 25 years ago. We use colonic and coffee enemas, but that's a nice picture. This is chelation. Chelation is a slow intravenous infusion of vitamin C, along with some other ingredients like high dosage of vitamin C, plus EDTA when it's needed. That's another therapy that I use is the HBO. One day I told one patient, we got HBO. No, I don't see TB. No, I say, that's hyperbaric oxygen chamber. That's a good therapy. And then I use ozone therapy. Ozone therapy is very effective, I have a patient a few weeks ago from Mennonite, from Texas, and he's dealing with colon cancer, and he decided to go to Germany. First he take chemo in Dallas, and then after things fall down, he comes with me, and I say, this is a patient that he don't want to see doctors. So he always brings his wife with me and check my wife. And I check his wife and I say, what about you? No, I'm fine. So he ended up with colon cancer. And then he went to Dallas, spent a lot of money. He's a wealthy man, but he spent a lot of money. And then he comes to my clinic. And then the daughter say, go to Germany. So he went to Germany. And he come back to the clinic and say, you do better than German. I don't know if it's true, but I'm being German. German people, they know what they're doing. They do ozone. They do light cell therapy. They combine therapies. That's what I call, I don't know how to pronounce that word, but integral. How you say integral? Integral. Integrate medicine. Exactly. Sorry about my last name is James, but I'm not American. I born by mistake in the United States, but I'm happy because I got both nationalities, Mexican and that's ozone therapy. That's when people smoke. Well, people smoke. Smoking is not good for anything. So sometimes, doctor ever used to take the cigarettes from the patient and throw in the garbage. And sometimes patients go to the doctor Evers, and that's the only doctor I see to do this. When a patient comes to him, after doing these few tests, he say, you need to stay 21 days. And the patient say, no, I don't have time. Go home, and when you got time, you come back. He was that type of doctor, If you are scared, you do what he say, and he give you a good choices. Well, that's breast cancer. Breast cancer is killing people, American women. Why? Diet, hormones, and some other genetical factors. That's you don't wait to be like that, because that's bad. Exercise. These days we're so busy. We don't have time for anything. Last night, did somebody see last night the moon? Was a full moon, beautiful moon. Even at this morning, 7 o'clock, still the moon was, So I take my time. I wake up early. Dr. Everett was one of the things. So I wake up early, about 3:34, and I